We're going to look at another infectious disease, and that is poliomyelitis. Now, poliomyelitis is basically a viral disease or caused by a viral infection, which is polio virus, that is mainly characterized basically by a very sudden or rapid onset of paralysis or even death. However, that is not the only thing that happens in this disease. And the disease itself is basically an inflammation disease where we have inflammation of the spinal cord. And the name poliomyelitis is simply the breakdown of those three aspects. Polio, which is the gray matter, the myela, which is the spinal cord, and itis, which simply is a term used to refer to inflammation. So poliomyelitis in some instances might be referred to as infantile paralysis. So the poliomyelitis as a disease has been a thorn in the world, and sometimes back it was a major health problem. And in 1988, the World Health Organization basically came up with a resolution to eradicate polio. And from then on, they went into an aggressive campaign that involved all these countries in the world to try and eradicate polio. And even though the objective has not yet been met, some very positive things have happened in terms of reduction of polio incidence rate in the world. So basically, since that time up until to most recently, the number of new cases of polio were reduced by actually almost 99%. So we know this is a disease that is commonly affects children under 5. However, we have to know that it is not limited to children. It can also affect older population or the adults who are especially not vaccinated. We know that there is no cure for this disease. We only deal with vaccines, and we have two major ones that are currently being used: OPV, which is oral polio vaccine, and IPV, which is inactivated polio vaccine. So in terms of some spread and pattern of this disease, we know polio infection used to be very common in Africa. So we don't just want to focus on Africa, all over the world, but in other parts of the world have made major strides in actually almost eradicating or basically reducing the incidence of polio. However, in Africa, it was a major issue, but there are major strides that have been made in that regard. However, we still have some outbreaks that still happen here and there in most of the African countries. But in the long run, basically, there has been major improvement. So the infection gives, once one is infected, they end up having a lifelong immunity. And we have 3 types of polio viruses, which we'll look at later on. And the virus is mostly detectable in feces and also sometimes in pharyngeal secretions. So people who are symptomatic can pass on this disease. So persons with a symptomatic infection, including children, are mostly reservoirs for this virus. And we have the issue of paralysis in some cases of poliomyelitis, and risk of paralysis mostly increases with age. So those, especially like children under the age of 3, most of the time they will not have this paralysis, but an older population, an older age children or even adults, if they are unimmunized, they can end up having paralysis as one of the manifestations. So we have already alluded to the fact that people who are not immunized are highly at risk, or people who are partially immunized. So we know that the schedule of polio is they have to get several injection for it to be effective, and we'll see why. People who also have poor hygiene, people who also stay in crowded areas, because we have also said there's a possibility of person-to-person transmission, not only via fecal-oral, but also we might also have some few cases, even though it's rare, some droplets. So environmental conditions can also predispose one, and also if one is immunosuppressed. So in terms of cause, we know that the cause of poliomyelitis is the polio virus, which is an enteric virus, and we have already alluded to the fact that we have 3 different strains, type 1, 2, and 3. They have different names, and these ones cause different kinds of epidemics. So like Brunhilde is known to cause the large epidemics, and the small ones are by Lyon or type 3. And there's some isolated sporadic or small outbreaks that are caused by the type 2 Lancing strain of polio virus. Now, the causative agent itself, we have already said it's polio virus. We have said it's an enteric virus, but it is in the family of Piconaviridae. And this virus was first isolated in 1909 by Karl Landsteiner and Erwin Popper. So these 2 gentlemen, they actually did a very good job, and actually they got rewarded for this. So there are 3 polioviruses serotypes, type 1, 2, 3. We've already alluded to this. And typically, poliovirus is an RNA, single-stranded RNA virus, which is non-enveloped, and they have a nucleocapsid, which is icosahedral. But the poliovirus is mostly hardy. Basically, it's something that is able to, it's a virus that is able to survive in harsh conditions as opposed to most of other viruses. So it's a bit resistant in a way, or hardy in a way that we can put it. So now that we know the virus itself, so how is it specifically transmitted? So first of all, we have to know that poliovirus is highly contagious. And that's why a lot of measures are taken when even a single case is reported. So it's very contagious, and they spread normally from person to person contact. So we know that it lives in an infected person's throat and intestines. And the intestines is, or basically the gut is a very important part, or is a very important aspect of the pathophysiology of poliovirus or poliomyelitis as a disease. So it enters the body through the mouth, okay? And that is it. It must enter the body through the mouth for it to cause the disease. Even though we have said that it spreads through feces, that is the most common pattern, and droplets from a sneeze or a cough, which is less common. The droplets have to be passed on through the mouth. Okay, so if somebody sneezes, or you touch you touch somebody's hand, or the droplets fell on your hand, and then you put that in your mouth, that is how it is going to pass through. So not that droplets pass through your nose and then it goes that way. No, if it goes through your mouth and then gets to the gut. However, these are very less common mode of transmission. The most common mode of transmission is through the fecal-oral route. So in terms of incubation period, the incubation period because it is not always that we end up with paralysis in poliomyelitis. So we can either have a paralytic pathway, or we end up having a non-paralytic pathway, basically. So those who end up having non-paralytic poliomyelitis, the incubation period is quite shorter. So 3 to 6 days, people will start having some signs and symptoms that we look at. So they take a quite short time, as opposed to those who end up having paralytic poliomyelitis. The incubation period is a bit long. So like between 1 and 3 weeks, basically, we might have this manifestation. So we have already discussed the transmission and also the causative agent. So how exactly do we end up having the paralysis or the effects that end up having we see in the central nervous system? Now, first things first, we say in the transmission. So we get the virus through whichever transmission mode. It is passed through the mouth. Okay. So through the mouth, it goes to the gut. Okay. And in the gut, that is where the virus now attaches to the epithelial cells, the endothelial cells, and then they multiply there. Now, once they multiply in the gut, okay, some of the virus is able to seep through through the lymphatic system of the gut or the small intestines. So remember, we have mesenteric lymph nodes around there. So they seep into the lymph nodes. And we know that all lymph ultimately ends up back going to the blood. Okay. So the virus, the same way, it will pass from the lymphatic system and then goes to the blood. Okay. So in the blood, that is where we call it viremia, because now we have the virus in the blood. So in the blood, some of the virus is able to cross the blood-brain barrier, and it goes to the central nervous system. So that is what we call the neural phase. So once it is there, it normally likes affecting specific part. There's a specific that's why the virus doesn't end up causing things like dementia or other things, because there's a specific kind of neurons that they focus on, and those are the motor neurons. So they go and focus on the motor neurons, and that's where they really affect. And that effect on the motor neurons is what leads to paralysis. Okay. And so as you can see, we start from getting the virus via the gut. It goes to the via the mouth, goes to our small intestines, seeps through the lymphatic system. From the lymphatic system, goes to the blood. From the blood, crosses the blood-brain barrier, and then goes to the brain. Specifically, it goes to the part of the spinal cord where we have we have a lot of motor neurons, and ultimately causing paralysis. Okay, so that's what happens. So we have seen that we can either end up having a lot of major issues, or we can have minor illnesses. Okay, and this is the majority of the people who get the virus, majority of them do not end up having a very big level of severity in the clinical features, basically. So the minor illness affects almost 90 to 95% of the cases are normally minor, where we have fever, malaise. So we have flu-like symptoms, basically fever, malaise, headache, nausea. And remember, we say these ones just take, the incubation period is even short, so take a few days to actually show this. Most of the time they're self-limiting. If the immunity is okay, they're healthy, they can easily get back to a normal state, normal healthy state. Okay. However, in some instances, we can end up having major illnesses. And these we can divide it into three parts. The pre-paralytic. Remember, the major illness is mostly having issues with paralysis. Yeah? So the major illness, we can have pre-paralytic state, paralytic state, or post-paralytic. Okay. So in this pre-paralytic, basically, this is associated with where we're having inflammation of the meninges. The virus basically has infected the bloodstream. We have viremia. So basically, we'll have signs of infection like myalgia, fever, sore throat. So, however, within 1 to 2 days, these symptoms normally disappear, and the time for temporary improvement may aggravate basically the degree of paralysis that we'll have later on. Okay. So physical activity at this time may aggravate. So if you restrict a lot of physical activity at this time, you might reduce the level of paralysis or the extent. So that's why, as you'll see later on, bed rest is an important aspect. So things like sports activity or other things that really overwork that person at this moment might really lead to extensive kind of paralysis later on when you get to the paralytic stage. So the client, however, in this stage, because it's pre-paralytic, they can either proceed to paralytic stage, or they might actually recover, and then it is simply like a minor illness. So if they proceed, this is now where we have a severe debilitating form. Basically, we have the setting in of paralysis, and this paralysis occur in any part of the body. And one thing we have to remember with poliomyelitis is that the paralysis is asymmetrical most of the time. Okay, even the paralysis of one side of the body and the other one is not the same. Okay, rarely will you get symmetrical. So the legs are the most affected part than the arms, and it's because the motor nerves, the motor neurons that are normally affected are the ones that are the lower ones, the ones that the ones that affect the lower part of the limbs. Basically, now the legs, okay, rarely will we get in the arms, but we can still get paralysis there. So the spread of paralysis is usually very fast, within 24 hours, and maximum extent might take up to 4 days. However, the onset is very fast. So there's myalgia also in the affected muscles. So this paralytic stage we can have three forms, okay? Either the spinal, bulbar, or bulbospinal. This simply refers to which specific part that has been affected to lead to this paralysis. So the spinal form, this basically involves the extremity, the neck, abdomen, diaphragm. So it is the most common, and we have flaccid paralysis here. Basically, the lower limb is more affected. So one important thing we have to know that paralysis occurs, however, there is no sensory loss. Then the other form is the bulbar form. So this is severe than spinal form, and it involves not only the extremities, okay, but it also involves vital medullary centers, okay? So things like breathing might be affected, eating or swallowing, basically, okay? So it is characterized by paralysis of the muscles supplied by the cranial nerves. So things like dysphagia, dyspnea also occurred. So the death that people have in this case is mostly because of respiratory failure, because you see we have even dyspnea because of the effects of the vital medullary center. Then you have bulbospinal form, which is basically a combination of spinal and bulbar form. And this is very rare. However, it is the most fatal. You can imagine, yeah, spinal and bulbar form. So it's very lethal. So this is just some of the images we can see, some of the contractures we get for people who have paralysis. So, and then this is one of the inventions that were done, especially were used some time back, and it's called the iron lung. And remember, we said you have an effect on your muscles, the breathing muscles, basically, even your diaphragm, and it collapses because it's paralyzed. So you do not have expansion and relaxation. So what happens is that you have negative pressure that pulls it pulls the lungs of this patient, and at least helps them to breathe. Okay, so that is the iron lung. So the post-paralytic stage is a residual disability stage. So already the paralysis occurred. So paralysis or weakness of muscles leading to deformity. So these are occur. So the poliomyelitis or the viral infection has gone away, but now these are what remains. Yeah. So somebody is left now with some sort of paralysis. So any paralysis that presents after 60 days is likely to become permanent. Okay. So how do we diagnose? Now diagnosis is quite normally easy, and it's normally by just doing taking history and just doing physical examination. And from the clinical features that you will get, that is acute onset of asymmetrical flaccid paralysis, that might lead to a diagnosis of poliomyelitis. However, also it's also good for a lumbar puncture so that they actually able to see whether we have viruses in the cerebrospinal fluid. Viral cultures where we have samples from stool, throat, or CSF. Imaging can also be done actually to try and ascertain and see the extent of the damage. So management, we don't have a lot of things in our toolbox to actually deal with this. So no specific regimen can be used. However, all cases of paralytic poliomyelitis should be admitted. And so what we just do is supportive management, where we just isolate and make sure we have strict bed rest, try to minimize handling of affected parts, to also reduce injections if you have to, then managing of pain, aiding in ventilation, making sure we have good nutritional care and also fluid intake, trying to suction any secretion because we might have inability to remove it, and then monitoring blood pressure, especially when we have like bulbar damage, like remember in the case of the bulbar form. Then physiotherapy is very important, especially to avoid those contractures we have. And remember, we have this sort of paralysis, myalgia. So we have a lot of musculoskeletal problems that come with it. So physiotherapy is absolutely necessary. So in terms of prevention and control, first of all, we have to recognize that poliomyelitis is a notifiable disease. So any case, even a single case, it has to be notified to the public health officer or public health nurse, whoever deals with the reporting. So your most immediate public health official. Then vaccination is important currently. So the Sabin vaccine, or basically the live attenuated vaccine, also together with the inactivated one, they're now routinely given, and they're in the EPI schedule. So they are given at birth. So like the oral polio is given at birth, or within 2 weeks of birth, then 6 weeks, then every 4 weeks after that. So 6 weeks, 10 weeks, and 14 weeks. The inactivated vaccine is only given at 14 weeks as an injection. So this vaccine also tried to cover the 3 types. So what happens with this? What happens with this vaccine is that, yes, in the vaccine we have all the 3 strains. However, once you're given, it's only one that becomes dominant, one type of the virus. So that's why you have to be given several times. Okay, so that's now once you're given the one that is dominant, is able to give you some sort of immunity. Okay, remember we said basically what happens is that once your immunity gets challenged with this virus, you get lifelong immunity. So because there are different types, you have to be given different times, because once you're given, only one becomes mostly dominant. Anyway, there is also mass vaccination campaign in case of any outbreak, and an outbreak here would even mean 1 case. Then proper surveillance, especially in different areas that we normally get these cases, like endemic areas, or if we have a porous border with a country that is known to have endemicity of this disease. So basically, very, very strong surveillance system. Then contact tracing and treatment. So for any case that has been reported, we have to know people who are in contact with those people or patients, and then make sure that the treatment is done. So I know that has been long, but I hope that has been helpful for poliomyelitis. So thank you very much.